show where doctors drop your white coat and talk real. So today we have with us Dr. Mittal, who is a very leading surgeon, Dr. Vikas Mittal, who has shaped ophthalmology in your city, Ambala. So today we have some very fun questions for you, sir,
Sure,
related
looking forward.
to ophthalmology. So being an eye doctor is like,
Fun. I love it.
I wish patients understood that.
Doctors are also human beings.
The one thing I hear every single day in OPD is,
बहुत देर होगी डॉक्टर साहब अब तक नंबर नहीं आया.
oh God. What's the most unexpected thing a patient brought to your OPD?
So we keep getting some difficult cases every now and then, I think. So these unexpected things keep coming every day. You know, sometimes when you are expecting that these are the kind of patient that I'll get, and then sometimes, you know, something pops up. And majority of them are challenges where you feel that this patient is going to be all right, right? And then suddenly comes that he's not well. So you know, I think that is that's an area where that's an nature's own way to tell us that stay alert.
God, stay so alert. Okay. What's the funniest home remedy you ever heard for an eye problem?
आपको अगर आंख में अंजन कुछ अगर इन्फेक्शन हो गया है तो हनुमान जी का एक टिक्का लगा लो.
हुई हुई काजल भी.
काजल तो बहुत ज्यादा है. और वो कुछ लोग क्या करते हैं, वो the other day I saw a lady who had a tika here, bindi kind of thing, and I couldn't understand. She was in pain, and then I couldn't understand why this atta kind of thing is stuck here. So I gave her treatment, everything, and then she went off. One of my staff said, I asked him that what is that? What was she doing over there? She said there is this atta and they do a puja of that and then they place it here. This is going to relieve the pain. That's what they strongly believe. So that was the first time I had heard about it, that this kind of home remedy also exists.
And there's a power of kajal out there, like mothers and our ancestors, I hope, believe that you apply kajal and your kids' eyes are going to be very nice.
Yeah, this has been there since ages.
Is it true? Does it work?
See, it's not that by you know, applying kajal, eyesight will be all right. If it's so, then all the eye doctors will be out of business.
Sure.
But I think they had some of their own thought process. Maybe it makes the eyes look good. I think it's more of a cosmetic importance than the therapeutic or the treatment per se.
So the child looks cute, but
Yes.
that's not healing the eyes.
So if there's an eye problem, please meet the doctor.
Please don't miss your eye test just because you're applying kajals. Okay. So my go-to stress buster after OPD is
talking to people. You know, anyone, even talking to my patients, connecting with them, listening to their stories, and you know, trying to understand what is going through in their lives. I think that's a major connecting with different human beings at a subtle level. I think that is my stress buster. I love it.
That's great, sir. And sir is a very corneal tattooing specialist. This is a very new era. So can you please introduce us to corneal tattoo?
I'm a cornea specialist, and cornea tattooing is one particular type of surgery where, you know, if somebody's cornea is white, you can apply some pigment over it so that whiteness goes off. That is of cosmetic purpose. So, but cornea per se has a, you know, huge areas. There are lots of patients who have these corneal diseases, and I think I chose cornea. That is also because of one patient where I saw in my OPD I was, you know, not able to manage it, and then I thought that, you know, I should do a super specialty in cornea. So there are lots and lots of those patients.
So sir, one day if I wake up and I say I want blue eyes, should I get corneal tattooing?
So I think you want to look more and more beautiful, right? You already are. But see, it's not that tattooing is meant for normal eyes. It's not. Tattooing is meant for people who have a whiteness in their eyes. The cornea looks black, although it's transparent. It's not black, right? It looks black. There are people who get some trauma, some infection, or something like that, and that blackness becomes white. That looks odd, right?
Yeah.
To cover that, to so that white doesn't pop out,
Yeah.
and it remains black. That's where we do a tattooing. So it's not for normal people.
So guys, no, don't go for colored lens just with corneal tattooing.
Yeah, so colored lens is different and corneal tattooing is different.
Yeah.
Colored lenses there are contact lenses where different kind of colors are present. Those are safe.
Okay.
Right. So in case sometimes people come that they want to go to party and they want their eyes to look in a different particular colored way. It's absolutely safe if it is a proper brand, and everything is taken care of. You take care of contact lens hygiene. Is absolutely safe. Tattooing is altogether different. Tattooing is a surgical procedure. You'll have to do a surgery to do the tattooing. That's a permanent procedure.
Yeah.
But contact lenses is tomorrow blue, brown, whatever.
So contact lens, corneal tattooing, for eye color, no.
Yes, absolutely.
Absolutely, yeah. Okay. And sir, we also got introduced to one more disease called keratoconus. Can you please introduce us to this?
Yeah, see, keratoconus is a disease which we see, I think, more common in last, I would say, 4-5 years. The incidence has increased. What is keratoconus is? The cornea is the black part of the eye.
Yeah.
It is nothing but a lens. It's a convex lens that focuses the light inside. That's how we see, right? It's just a lens. In few patients, because of some or the other genetic issues, and sometimes majority because of eye rubbing, lots of rubbing, that cornea becomes weak. So instead of lens, it becomes a plastic kind of thing which stretches out. And because it stretches out, so suppose you have a lens, 43 diopter lens, it stretches out. What will happen? It will not focus, right?
Okay, so sorry, I'm just stopping you. Just because you rub the eye a lot, your upper layer is becoming a
weak.
Yes.
Eye rubbing is the strongest associative factor with keratoconus. So keratoconus is a disease where the eye cannot see clearly because the lens, the cornea, is no more strong. It's biomechanically weak and it is stretching up. And because it's stretching up, it's not able to focus. And you're right, one of the most important factors is eye rubbing. So if the child is rubbing eyes, moms, ensure that you show it to the doctor.
Yeah.
And rubbing is not good at all.
Seriously, eye rubbing
Yes.
can be a big problem.
Yes.
And is it curable?
Yes. So majority of keratoconus patients are curable.
Okay.
So it has a stages. It's sometimes we pick up very early stage of keratoconus. We do some treatment, sometimes some medication, sometimes minor surgery, and it stabilizes. It doesn't progress. But if it has progressed to really advanced stages, then we might have to do a different kind of surgeries. But all keratoconus patients, majority of them are treatable, curable, either with medicine or with surgery. But better is prevented. And it's only one small thing: don't rub your eyes.
What are the 5 best habits that you can suggest a person in daily life to take care of their eyes?
See, I think that depends. If these are kids, you have to ensure that you don't rub your eyes, and preferably your hand should not touch your face at all. That's the best habit you can have. If your hands, during COVID era, what was the key thing? What was the major advice? That don't touch your face, because it's all allergens, or the organism contamination, everything is on your hands.
Yeah.
So from my point of view, don't touch your eyes. In case you have a problem, please go and consult somebody. And if you are around 40 years of age, ensure that you have your eye checkup done, because at 40 years you start seeing some blurry at near vision, so you might need some glasses. Important, if you have a family history of glaucoma, ensure that you see your doctor as early as possible, because we'll be able to take care of it. Another very important thing is, if you have diabetes, must show it to a doctor, because diabetes can actually take away the eyesight. But if it is, checked early, and we see it well in time, it can be totally preventable. So I think I would say, don't touch your face. If there is any issue, please consult your doctor. Diabetes, family history of glaucoma, ensure, and do not rub your eyes.
That's very insightful. And so, one last thing that patients find really confusing in this Google era is, what should you trust more, the word of mouth or the word of internet?
See, we'll have to understand that in internet, it is not that it is going to be a science-based or factual-based information. Internet, you can post anything, I can post anything. So that is my view. If it's you are posting, it's your view. That doesn't mean that that is scientifically correct. So I would strongly suggest that in case you are, seeing Google or any internet for any disease, please see what is the source, right? Is it a scientific articles? Is it a scientific sites? And see, no matter how much, see, for example, my mother had to undergo knee transplant. I'm a doctor, but I'm not a orthopedician, and I'm not a knee transplant surgeon. No matter how much I study, no matter how much I study, but I cannot match the person who has enough experience, who see these cases day in and day out. He has a sixth sense, right?
Exactly.
So when I went to the doctor for my mother's knee operation, I just told him that I just did some research on which doctor I should go, which center I should go to. But once I was there, I said, Doc, I have all trust in you. Please go ahead and do, whatever best. And he told me that, see, we have this option, this option. I said, no, what do you think? If it's your mother, what would you do? Go ahead. And touch wood, my mother is so well, so good, even after 1.5 decades of that surgery. So I think whenever you are doing internet search, please see what is the source. Is it some random person's blog? It's somebody's view, somebody's opinion, or is it a science-based thing? Some there are so many scientific journals. So is it from there?
So, guys, internet is definitely not your doctor. You can Google your symptoms, but do not rely on them. Go visit a doctor and get treated.
Yes.
So, thank you so much, sir.
Thank you
That
so
was a
much.
really
Thanks
great
so much.
information.